Communicating for Antibiotic Stewardship. This video is part of the Communicating for Antibiotic Stewardship series. Videos in this series provide evidence-based training on fundamental communication skills that primary care providers can use to reduce patient expectation for antibiotics while maintaining their satisfaction with care. Working with the difficult patient. Many patients are appreciative of your care and happy to follow your advice. However, some will challenge your viral diagnosis, demand antibiotics, and reject non-antibiotic treatment advice, making it harder to practice antibiotic stewardship. This short video provides practical, research-based strategies for communicating more effectively with these difficult patients. The strategies can be used individually or in combination to help improve patient care and satisfaction with non-antibiotic treatment. These strategies are of two types. First, there are strategies to reduce the likelihood of disagreement over antibiotics, including 1. Using pre-visit education to reduce patient desire for antibiotics. 2. Managing patient expectations by foreshadowing diagnosis during exam. 3. Showing you care about your patient's illness. Second, there are strategies to manage expressed disagreement over antibiotics, including 4. Eliciting and responding to the patient's individual concerns. 5. Making contingency and follow-up plans. 6. Taking professional responsibility for the prescribing decision. To start, there are strategies to reduce the likelihood of disagreement over antibiotics. 1. Using pre-visit education to reduce patient desire for antibiotics. Patients demand antibiotics when they are sick because they believe they need them to get better. To modify this belief, look for ways to communicate with patients about antibiotics before their medical visits. Videos, brochures, and other educational materials are available from many reputable sources. These materials can be sent to patients directly through email and text, shared on social media, and placed in waiting or exam rooms. Also remember that a medical visit now can educate for later visits. With patients who currently have bacterial infections such as strep throat, you can discuss why antibiotics are needed for the existing illness but not others. This will prepare patients to receive non-antibiotic treatments for different illnesses in the future. 2. Manage patient expectations by foreshadowing your diagnosis during physical exam. Patients will be less likely to argue for antibiotics when they better understand the reasons behind your diagnosis. As you conduct your exam, discuss the physical findings that support a viral diagnosis. This foreshadowing will make the eventual diagnosis more understandable to your patient. For example, when looking at your throat, I don't see any redness or discharge from your tonsils, which I would expect to see if you had strep throat. I also don't see any redness in your ears. These things tell me it's unlikely you have a bacterial infection. 3. Show you care about your patient's illness. Patients are less likely to become frustrated with a diagnosis if they are confident that you care about their condition. Convey caring by acknowledging patients' physical discomforts and stating your intention to help with symptom relief. For example, let's talk about some options for soothing that harsh cough so you can sleep better. In addition, there are strategies to manage expressed disagreement over antibiotic prescribing. 4. Elicit and respond to the patient's individual concerns. Behind their arguments and demands, difficult patients have reasons that motivate them. It's understandable to feel aggravated when patients challenge your expertise, but don't let that guide your response. Start by remembering that patients who seem uncertain or resistant in response to a diagnosis or treatment plan are not always seeking antibiotics. They may be driven by other concerns. Then, use open-ended, non-defensive questions to find out what is motivating your patient and tailor your responses accordingly. For example, what are you concerned will happen if you aren't prescribed an antibiotic? Your patient's answers to these questions will help you provide the right kind of information or assistance that the patient needs to feel more comfortable with your diagnosis and treatment. 5. Make contingency and follow-up plans. Patients who think they need antibiotics will often be more comfortable with non-prescribing if they believe you will reconsider the decision if needed. Acknowledge the possibility of bacterial infection and be specific about the types of worsening symptoms that would indicate a need for reevaluation. For example, sometimes a bacterial infection does come along after a viral infection. If you start to feel worse, and especially if you start to run a fever, I want to know right away. Setting a definitive plan for follow-up regardless of outcome can also reassure patients who are questioning non-antibiotic treatment. For example, please call or message me in 48 hours so I know how you're doing, even if you're feeling much better. 6. Take professional responsibility for the prescribing decision. You are the healthcare provider, and the prescribing decision reflects your effort to provide appropriate medical treatment. Express this commitment to your patient. For example, as your doctor, it's important for me to give you the best care. Prescribing an antibiotic for a viral infection isn't good care. As a last resort, politely agree to disagree, but don't change your prescribing decision. If you think it's appropriate, you can refer the patient to another provider for a second opinion. In summary, this video has presented 6 strategies for communicating with difficult patients. Strategies to reduce the emergence of disagreement over antibiotics are: 1. Using pre-visit education to reduce patient likelihood of demanding antibiotics. 2. Managing patient expectations by foreshadowing diagnosis during exam. 3. Showing you care about your patient's condition. Strategies to manage expressed disagreement over antibiotics are: 4. Eliciting and responding to the patient's individual concerns. 5. Making contingency and follow-up plans. 6. Taking professional responsibility for the prescribing decision. Used individually or in combination, these skills can help you promote antibiotic stewardship. For additional materials to develop this and other communication skills for antibiotic stewardship, visit this website.